this presentation is related to protection of the pilgrims against respiratory diseases during Hajj. And this speech will be delivered by Miss Betul Cakmak, a PhD student at Yildirim Beyazit University. Thank you. Hello. I'd like to thank the organization board. I'd like to thank for inviting me in this session. I work as a researcher in the nursing department in Yildirim Beyazit University. Today I will talk about certain practices that are related to protecting the pilgrims against respiratory diseases during Hajj. My speech will not be limited to COVID-19, but one of the topics. Well, pilgrimage, Hajj, is one of the biggest mass gatherings in the world, and more than 183 countries, in fact millions of people come together. And let's look at our country. At average 75 to 80,000 people in fact go to Hajj, and for Umrah 350,000 people go to Saudi Arabia every year from our country. And in fact our country is one of the top 10 countries whose citizens go to the Hajj. And during Hajj, there is a series of ibadah actions. And in fact, people go into close contact with many other people coming from different countries. And that contact may be a reason for many diseases. And it means that the pilgrims are under risk, at risk of many different diseases. For example, there is difference in climate, the air conditioning in closed indoor environments, and there is increased close contact during the ibadah activities. So respiratory tract infections, in fact, can be an important reason for the visits to clinics and also hospitalization. Let's look at the risks in respiratory diseases. Crowds, accommodation in extremely crowded environments, comorbidities, advanced age, insufficient vaccination, climate-related traumas, heat exhaustion, dehydration, hyperthermia, and also difference at the levels of protection. Let's look at the literature. 60% of the pilgrims, in fact, present to hospital with respiratory disease symptom at least once. Coughing, sputum, dry coughing, sore throat, rhinorrhea, fever, difficulty in breathing, and lethargy are the symptoms. In mass gathering areas, it's very difficult to take under control the transmission risk. And the treatment approaches are very limited for the virus origin respiratory infections. It means that preventive approaches are very important to be adopted during the Hajj, and awareness should be raised in this regard. In my speech, I will talk about certain practices that are related to protection against respiratory diseases during Hajj. I will provide you a brief look at the literature, and then I will try to make sure that proper nursing approaches are established. How can respiratory diseases be prevented during Hajj? Some information from literature. First topic is related to use of disposable wipes. Health institutions instruct that when sneezing and coughing, in fact, the mouth and nose should not be closed by hand in order not to cause the transmission, because with your hand you can cause further contamination. When you look at the manuals of our Presidency of Religious Affairs and also the Ministry of Saudi Arabia, the pilgrims, in fact, are required to have and carry disposable wipes with them. In fact, they will use it just once and then throw it away. You know, according to culture, sometimes the pilgrims may use handkerchiefs rather than disposable wipes. That can increase the risk of transmission. If disposable wipes are used, infection transmission will be less, and also the respiratory infections will appear 3 times less after return of the pilgrim to its home country. After explaining the importance of use of disposable wipe, the awareness of pilgrims is increased very highly. However, the disposable wipe can singly not have a significant effect in order to eliminate the symptoms of respiratory diseases. I just want to underline this. There is research from our country. It says that 28% of pilgrim candidates in fact use disposable wipes. This is a low ratio and that must be increased. Hand washing and use of disinfectants is the second topic. As a basic and effective approach in order to protect against infections, the health authorities in fact suggest hand washing and use of hand. The Muslims in fact wash their hands when they are having their ablutions in order to pray during the day, and in fact although the literature says that the pilgrims do not have sufficient information about the impact of hand washing to eliminate the respiratory diseases, they still have a high ratio of hand washing. According to our research, in fact, one group was provided with training about personal hygiene and also a health kit including hand disinfectants, and the other group didn't get these, and they checked the respiratory and derivative diseases. In fact, in the first group, those diseases were lower. We understand that that kind of training and also the health materials can reduce the respiratory diseases. So during the Hajj, in fact, water resources are very limited, especially for times other than ablution. So they can carry hand disinfectants with themselves. That can be a very effective tool in order to reduce the transmission. And also, you know, it takes a very short period of time in order to use the hand disinfectant. So we can remind the pilgrims to carry some disinfectants with themselves. Use of masks. If the mask is used properly, then it cuts our contact with the infectious agents and it can prevent transmission and spread of the infection and disease. And during the Hajj, the pilgrims are provided, with free of charge masks, and if they are instructed and explained about the importance of masks, then the awareness and the use of masks can be improved a lot. In fact, from 1998 to 2014, the use of masks increased from 17.8% to 64%. I think from now on it will be 100%. In order to understand the effectiveness of masks in the prevention of respiratory diseases, proper results could not be revealed in the diseases for certain reasons, because of the habits related to use of masks, etc. Since 2020, all around the world, COVID-19 pandemic was prevailing, and between the countries, you see differences as to the use of masks. And in the world, there is no mass use of masks, and the WHO couldn't have a proper attitude as to the use of masks at a collective scale. In June 2020, in fact, WHO suggested the use of masks. In fact, they said that it can protect the individual and also it can reduce and prevent the transmission. And here are the guidelines that are offered. If any citizens who are willing to go to Hajj are watching us, these relate to you. Before using the mask, it's important that you make sure of your hand hygiene, and you have to make sure that the mask rests properly on your nose, cheeks, and chin. And when you are wearing the mask, do not touch the external part of the mask with your naked hand. Never share your mask with anyone, it's private. And when the mask gets wet because of secretion or saliva, it should be changed, and disposable masks can never be reused. In fact, these guidelines come from the report and recommendations of WHO. In the report, there is some information related to cloth masks, because in the new articles, it says that 2.8 million of masks are used around the world per minute. That's a great problem about waste, because there are still the discussions into the recyclability of the masks. Currently, the used masks are not recycled but disposed. In order for waste management and sustainability, the rules related to cloth masks are embedded and included in the WHO report. However, cotton, celluloses, silk can be potential materials, and filtration efficiency may differ by materials. And there are some charts showing these figures. If you would like to use any cloth made mask, please read the report in order to understand which is more effective for you, because they need to be washed with soap at high temperature, and 1 per 1,000 chlorine should be used for soaking purposes. But during Hajj, I do not suggest using the cloth masks because cleaning can be a problem in those conditions. Taking into consideration the reports and recommendations of WHO, in fact, just wearing the mask is not very definitive for protectiveness against respiratory diseases. We should also encourage the better hand hygiene. Vaccination is another topic that was already explained by Professor Rıdvan, but I'd like to specifically talk about pneumococcus and influenza vaccines. These are related to respiratory diseases, and in fact, these are just recommendations. These are not obligatory vaccines. Just meningococcus vaccine is given as a mandatory vaccination. Since the other two are not obligatory, we can look at the literature as an option. Influenza vaccination is effective, and that is proven in many researches, because many respiratory tract diseases are related to influenza. And in fact, the symptoms and the use of antibiotics are higher in the group which reject to get the vaccination. So influenza vaccine, in fact, is a necessity, and it should be accepted as so. If the pilgrim sees a respiratory symptom during Hajj, and if that pilgrim starts taking antibiotics, it is some additional medication burden, but that is avoidable, and that can adversely affect the life quality of a pilgrim during Hajj, and that is an extra burden, extra financial burden for the pilgrim as well, because that antibiotic can be prevented. Maybe all the pilgrims should get influenza vaccine before going on Hajj. About the vaccination, the pilgrim candidates have different perceptions and different attitudes. This may be related to their environment, family, religious beliefs, and media. There are some researchers. For example, the pilgrims said that I do not believe I will get sick. I trust in my natural immunity. I don't have time for vaccination. I'm afraid of side effects of the vaccine, and I am not aware of the effectiveness and efficacy of vaccine. And also they asked the same questions to the group which got the vaccination. They said that they didn't want to get sick during Hajj. They didn't want to go to hospital when they were practicing the Hajj. They wanted to enjoy this ibadah in a healthier way. These were the responses they gave. In different countries, you lost 1 minute. Awareness raising and trainings are also provided in different countries in order to explain the importance of vaccination, and that significantly reduced the respiratory diseases. We suggest vaccination. COVID-19 pandemic has been severely affecting the humanity for last year, and it caused many deaths in Saudi Arabia in June 2020. The local population over 65 years old and also the international guests were forbidden from visiting the Hajj because the pilgrims are old, and in 2/3 of the incoming countries, the health services are not sufficient, and the respiratory diseases could be transmitted most during the Hajj. Now we understand that our lives can be affected a lot. Air conditioning, in the literature, I couldn't find any publications about this, but I think this is one of the most important topics, because Hajj ibadah is one of the longest ibadah, and during the daytime the temperature goes as high as 50 degrees Celsius, and there's a huge difference between the Turkish climate and the Saudi Arabia climate, and that can really threaten the health. High temperature you heard the effects from Professor Rıdvan that can cause hypertension, heat exhaustion, and similar complaints. In 2015, 2,000 pilgrims just visited the health high temperatures, and half of them were over the age of 50. In fact, now, when you compare this to the previous years, the number of visits to the hospital, in fact, is doubled. And because of temperature variations in future, this number will go higher, and the planning should be done very carefully. No contact with the sun, use of umbrella, and plenty of water to be taken are suggested. And as for state policies, there can be some umbrellas and shades around the mosque. They can be spray ventilators and fans in the tents. There can be high quality drinking water. These are some of the suggestions for the government in order to protect against high temperature in the outer. There are some methods, but when the pilgrims go to their hotel rooms, they use the air conditioner. So the air conditioner and the fans should be used properly in order to make sure of full protection. Only 3.4% of the pilgrims believe that air conditioner can be a disease factor for the respiratory tract diseases. That's an important information. In Saudi Arabia, in 1996, the air conditioners were shown in the mosque were shown as a reason for disease. So our pilgrims should be trained properly. I looked at the contents of the training of the Presidency of Religious Affairs. In fact, your manuals include some information about the proper use of AC, and you can raise some more awareness through trainings. I know that my time is no more there to talk about the details. You can find the details of the proper use by looking at my paper later on. Please avoid the crowded spaces. In fact, this method is advised very strongly nowadays, and also the pilgrims should try to avoid the crowded spaces. In Saudi Arabia, simulation models are used, the pilgrims are grouped, and also they develop some video-based watching and monitoring systems. Nursing during Hajj. So the medical and the religious professionals should work in coordination in order to provide the necessary services to the pilgrims. The pilgrims are vulnerable and they have chronic diseases. So the monitoring devices should be developed, and the parametric results, in fact, should be used with some technical applications. Necessary infrastructure should be created so that we can do these. As nurses, we also work in the Hajj to provide the necessary health services to the pilgrims, and the nurses should have the necessary level of knowledge in order to raise awareness in the pilgrims. There is a study related to the nurses, and the nurses wanted to have some training programs for themselves, and also they want the policies and procedures to be more innovative, more technology oriented, and more evidence oriented. And I have 3 or 4 recommendations for increased efficiency of the nurses. First, training should be planned in order to improve the quality of care for the risky groups. Cancer, chronic obstructive pulmonary disease, cardiovascular disease, diabetes, hypertension, and Alzheimer's are the chronic diseases that are common in pilgrims. So individualized nursing care should be provided based on these diseases, and policies should be developed accordingly. The nurses will work in the hospitals, yes, but also they should be visiting the pilgrims at the hotels and the facilities, and they should also make a good recording of their observations. And the nurses and the religious officers should inform the pilgrims regularly so that they are always at a high level. Can we get your last sentence, please, because there are 3 more people to speak in this session. Yes, I'm finishing now. Some guidelines for the pilgrim candidates, but I'm not going to read this. I have a long list of references. You can find them in my paper. I would like to thank you for your attention. I haven't experienced Hajj, and I got my information related to Hajj from my grandparents, and I would like to thank them for providing me this information. Thank you, Betül.